there's a couple things that we need to do here. We have to repair your gut because of the medication over the years, because of the overgrowth of the bacteria. What that is doing is it has created weak gut integrity. So your gut is physically in bad shape, right? There is damage physically to your gut. So even if you did have like therapy, for example, like that's not going to address the damage that's there, right? So we have to address the damage there. And then after we address the damage, now we have to help to fortify it, build it up, help to balance it out by doing the right things, balance out the natural bacteria. Like these are things that we need to do. And I believe that the consequences of you not doing that is a couple of things. You've come up with nutritional deficiencies that are showing up. And the reason why they're coming up is because you have an inability to be able to absorb proper nutrition. So you're taking these supplements and you'll get the test and it'll show your levels are up. But what happens is, okay, your levels are up, you stop taking them, then because it's an absorption issue, the levels come back down again. Then you take it again for a period of time, you raise it, then it comes back down again. You have to constantly go in to get these injections because your body can't hold on to it. So what happens is, if you did nothing over time, more deficiencies show up. And then you have to take more supplements. Then they want to do transfusions and things like that to get it in place. And because you're having this autoimmune type of response, this gut immune response, eventually it leads to other types of autoimmunity. So I think that consequences of what you're saying, thinking that eventually things will get worse, I think that's how it looks. It looks like some form of autoimmunity, because when it comes to autoimmunity, there's only a matter of time before something is introduced to your system that looks like something else. So it could look like your thyroid, and if it looks like your thyroid, then it attacks the thyroid. Your immune system attacks the thyroid. It could look like joint tissue, then it attacks the joint tissue. So depending on where it attacks, medically, they just give it different names. So they may say rheumatoid arthritis, Hashimoto's, Graves' disease, or whatever the case may be, they're going to give it a name based on what it's attacking. So we want to do things to prevent that.